me in?
Yes.
Hi, my name is Ibtesam Azad and I'm gonna be your student nurse today. May I know your name and date of birth, please?
It is Amber Birch, August 20th.
Okay, I'm gonna fit check name, date of birth with your band. Perfect. And is there any preferred name that you'd like to?
No, just Amber.
Okay, what pronouns do you
She,
use?
her.
She, her. Okay. So I'm gonna take your vital signs and do head to toe assessment on you. Before starting any exam, is there any cultural considerations that you need me to be aware of?
No.
Okay. And what brings you in here today?
Just a wellness check.
Just a regular. Do you have any kind of pain?
No pain.
No pain? Okay. But just to be sure, on a pain scale from 0 to 10, where 0 is no pain and 10 is the worst.
Just 0.
Just 0? Okay,
Yes.
good. So I'm going to take your vital signs, but before that, I'm going to wash my hands and wear the gloves. And take your vital signs first, and I'm going to take your temperature, which is normal. I'm going to measure your blood pressure, which is 120 by 80, which is absolutely normal. And then I'm gonna take your radial pulse, which is 72 beats per minute. And while I was doing this, I counted your respiratory rate, which is 14 beats per minute, which is normal. And I want to give you 3 words to remember. I might need to know these 3 words at the end of the examination. So these 3 words are river, sunshine, and cat.
Okay.
Can you repeat that after me?
River, sunshine, and cat.
Good, perfect. So yeah, I took all of your vital signs and then I'm gonna start my head to toe assessment on you. I have consent to touch you.
Yes.
I have your consent. Yeah. Okay, thank you. First, I'm gonna inspect your head and face. Your hair looks perfectly normal, well groomed, maintained. Scalp is not dry, and your face looks in symmetrical position. Your skin color looks normal in contrast to your body. Your appearance look, happy or like normal, regular condition. I don't see any scratch mark or bruise or lesion or anything abnormal in your face. And then I'm gonna just palpate your head a little on the front and then go back a little. There is no swelling or wound or lesion. Skin is intact. Your hair distribution line looks perfectly normal. I'm just gonna do a quick whisper test. So for that, I need you to close one of your ear on one side at a time and tell me, can you hear that sound? Okay, on the other side, please.
Yes.
Can you hear that? Okay, good. So, and now in front of your face again, then can you raise your eyebrows, please? Good, perfect. And your eyes looks in symmetrical position. Can you hold your eyes a little bit? The lower eyelid, yeah, there. Your sclera looks white. Conjunctiva looks perfectly pink. I'm gonna do some quick light test on your eyes. So, good. Your pupils are well reactive to the light. And then I'm gonna do the accommodation test. So for that test, I'm gonna move this light, and without moving your head, try to follow the direction of the light with your eyes, okay?
Okay.
Okay. Good. Then I'm gonna give you some paper here. Can you read those words for me?
Yes. VANILLA.
Good, perfect. Thank you. And I'm done. done with your eyes, then I go for your nose, and your nose looks normal in shape. There is no deviation of nasal septum. And I'm gonna do a quick sniff test for you. For that, I need you to close your eyes and close one nostril at a time. Can you tell me which
Cinnamon.
smell? Okay, good. Awesome. And do the other side.
Vanilla.
Okay, good. And then I go for your, you can open your eyes, yeah. And then I go for your lips and mouth. Your lips are red, good, well hydrated, and there is no cracking of the skin. Can you open your mouth for me? And I'm gonna look into your oral cavity. Can you stick out your tongue like Okay. Your oral cavity looks clean, well hygiene, maintenance done, and there is no stain marks on your teeth, and your tonsils are in symmetrical position. There is no wound or lesion or any signs of inflammation. So you can close down. Okay. And can you smile a little for me? Good. And can you frown? Okay. And is there, I think your face is in symmetrical shape, and I'm gonna feel your face a little on the down of the chin. There is no lymph node enlargement in front of the ear and your back of the ear. There is no enlargement, so normals. And I'm gonna do a quick touch test. So just to want you to know, this one is soft and this one is a sharp touch. And for that, I want you to close down your eyes little, and I'm gonna touch. You are gonna say me what kind of touch is it and which side is it, okay? Okay.
Soft cheek. Soft other cheek. Soft cheek.
And I'm gonna go down through your upper and lower extremities too.
Okay. Hard hand. Soft hand. Hard leg. Soft leg.
Okay, perfect. Thank you. And now I'm gonna go with your upper extremities. So can you shrug your shoulder for me? Good, perfect. And can you hold this position and shrug again? Good. Perfect range of motion, like shrugging of the shoulder joint. Can you do this for me? Good. Range of motion of the shoulder joint is intact and normal, working in perfect position. And can you side your neck a little on the other side, please? There is no visible jugular pulsation, and I'm gonna check your carotid pulse at one side first, and then do the other side. Your carotid pulse is strong or an asymmetrical condition. And then I'm gonna check your heart sound first, and then gonna check your lung sounds. Can you hold up your chest a little? Yeah. Thank you. And then your heart sounds are normal. Your lung sounds. While I'm doing this, can you please take some deep breath in and out through the whole time? Take deep breath in and out. Okay, again. Good. I'm gonna go backside to listen your lung sound. Can you bend a little for me. Yes, okay. So take deep breath in and out. Okay, good. Your lung sounds are normal and there is no labored breathing. And then I'm gonna go for your upper extremities. I'm gonna inspect, and your muscle tone is normal, perfectly toned muscle. I don't see any kind of tattoo or any bruising or any lesion, bruise mark, scratch. There is no varicose vein and there is no edema. Your skin looks perfectly hydrated. There is no dehydration. And I'm gonna check your capillary refill. So skin goes back to the red position, so your capillary refill is normal. And then I'm gonna take your radial pulse on both sides together. Radial pulses are strong and in sync. And so, and I want you to squeeze my fingers hard. Good. Can you pull my fingers towards you? Okay, and push my fingers towards me. Good. And can you do this? Can you do this? Okay. Can you do this? Good. So I want you to stand up a little for me. And can you close your eyes and holding your hands like this? Yeah. Okay, good. There is no drifting or drooping on the side, so you can sit down. And I think I'm done with the upper extremities. Let's see. I think I can now hear your abdomen sound. For that, can you please lie down for me? Your abdomen looks in shape, in perfect normal shape. There is no distension. I don't see any bruise or any cut mark or any lesion or any scratch. Can you cough me a little? Can you cough for me? Okay, there is no hernia. So I can see that there is no hernia causing anything. Do you have any pain or any tenderness right now? Okay, so I'm gonna auscultate first in all four quadrants of your abdomen to hear the bowel sounds. So when did you have your last bowel movement?
An hour ago.
Okay. So bowel sounds are present, and I'm gonna palpate your abdomen. Please let me know if you feel any kind of pain or any tenderness, okay?
Okay.
Okay. So there is no pain and no tenderness, no rebound tenderness, okay? Okay. Thank you. You may take your seat. And I think I'm now going for your lower extremities. I'm gonna check your plantar reflex here. Your plantar reflexes are strong. Your lower extremities looks perfectly in shape. There is no there is no tattoo I can see of. There is no varicose veins and there is no edema. Your skin looks well hydrated, and it's not dry, I mean well moist, and your muscles of the lower extremities like toned. And now I'm gonna go for your dorsalis pedis pulse. So your pulses are strong and in sync, and same goes for your posterior tibial pulse. Okay, and then I'm gonna feel your foot a little. Can you press down my hands with your foot? Okay, and can you um, pull your feet upwards against my hands? Okay, good. So can you foot tap like this? Okay, and I want you to stand up a little, and can you do this like on the side, and do the other side, on the side, and then toe to shin taste? Yes, okay, good. Can you foot tap on both? Okay, and now I want you to walk down on that foot a little, and then while coming down, walk first in your tiptoe, and then on your heel, please. Perfect. Okay. And I think I'm gonna go check your back now a little. Can you bend forward so that I can check your spine? Your spine is in center. There is no protuberance or any deviation to any side of the spine. Do you feel any pain or tenderness?
No.
Okay, you can stand up, and then I'm gonna mildly parkas on your back for seeing the costovertebral angulation. If do you have any pain or tenderness, please let me know.
Okay. No pain.
Okay, good. I think you can sit down right now. And I want to ask you those 3 words. Do you remember that?
Yes.
Okay, can you tell me?
Beautiful river sunshine.
Okay, good. And I just wanted to check one last thing. Can you pop your mouth? Okay, I want to have you nose finger test. So for that test, can you, touch your nose first and then try to touch my finger wherever it goes, okay?
Okay.
Okay, so. Okay, perfect. I am done with your inspection of your head, face, and neck. And then go for upper extremities. You have good range of motion of both of your upper extremities and lower extremities. You have strong plantar reflexes and good range of motion of knees. And can you do this for me? Yes, good range of motion of wrist too. And you have bowel sound presence. I think we are almost at the end of the examination. Is there anything you want me to ask?
No.
Okay. So thank you so much for letting me do this assessment on you. I will let your provider know about you. And if you need me sooner, you can have the call light. You can push anytime you want. And thank you so much. And I'm gonna wash my hands and then maintain the hand hygiene and then say goodbye. Thank you.
Bye.
Bye. Have a good day.